is now the third largest country in the world in terms of liver transplant volumes. Liver patients can have jaundice, they can have bleeding, they can have a fever. Till when the damage is seen, it's already too late. There are a lot of myths and fears and anxieties that the families go through.
Liver and pancreas-related diseases are often silent, complex, and confusing for families. Many patients travel late or travel without having their full reports with them. Today, teleconsultation is helping bridge these problems by making access to specialists easier and faster. So today we have with us Dr. Somnath Chattopadhyay, Head of Liver, Pancreas and Biliary Surgery at Kokilaben Ambani Hospital, one of the premier hospitals not only in Mumbai but in the entire of India. So doctor, welcome to the podcast.
Thank you.
So doctor, I believe this is your first time in Guwahati.
Yes, and I'm loving it.
You're loving it?
Yes.
All right, doctor. So I would like to ask you some questions related to your field and related to teleconsultation in general.
Sure.
All right. So doctor, liver disease is often silent. Can teleconsultation help patients before the disease becomes advanced?
Yeah, I think it's very important for people to understand that liver has a huge capacity to a huge reserve. So as a result, the damage till when the damage is seen, it's already too late. So with the help of simple tests and a few simple imaging which is available in every corner of the country, we can diagnose most of the serious liver problems. So I deal with liver, pancreas and bile duct. The approach is different for every kind of different diseases. For pancreas, we need to act fast. So if there are new symptoms which tend to be ignored by someone who's not specialized, teleconsultation will help in that way also. So I think it is very helpful for people to get regular health checkups, and if they find something which is alarming, they should try and get the teleconsultation done.
Now doctor, let's say that a patient is here in Assam and he wants to consult a specialist in Mumbai. So if he has the right reports, is it like how much is it possible for the remote specialist to know about or to be able to diagnose the patient?
So the diseases that I take care of, I need to look at the blood test, which are available almost everywhere in the country.
Correct.
I need to look at like reports, like imaging, like ultrasounds, which are also available in most of the parts of our country. Sometimes I need specialized imaging for which I may ask for a more detailed consultation. But the initial diagnosis and kind of the way things should be planned, the treatment should be planned, can be done just with the help of teleconsultation.
So at least the initial screening or giving an initial idea to the patient of what the issue might be can be done via teleconsultation.
Absolutely. I encourage it all the time.
And in some specialties, we know that the resolution of the image is very important to helping understand the patient's issue. Is it the same in your case as well?
It is. So once the diagnosis is made, then for planning of any kind of a treatment like surgical or any kind of a treatment like a transplant or a surgery, then we need to get the high resolution CT scan images. But those things also can be sorted out by transfer of a link and things like that. So a lot of care can be done with the help of a teleconsultation. I'm not talking about emergencies where you need to go to a hospital, but for diseases which require a surgery or a transplant, teleconsultation will help in a long way.
Okay. Now, when it comes to the liver, do you believe that transplant-related doubts can be discussed online?
Absolutely. I think there are a lot of myths and fears and anxieties that the families go through before they come to a conclusion that they have to go through with a transplant. So I think these things can be discussed. Who can be a donor, what kind of transplant, what is the urgency of a transplant, what is the right time to do it. These things can be discussed over a teleconsultation. One more thing I have to add, that once the surgery is done, in cases where a liver transplant has happened or a pancreatic surgery has happened, it's important for it's very important to keep a long-term follow-up. So most of my patients, when they are from far from where I work, we do teleconsultations and manage them through these, because I need to look at the reports. Most of the patients are completely well, and I just need to make sure that the surgery which has already happened is going on well.
So basically, the continuity of care for the patient,
Exactly,
that whether the treatment is going as intended, or are there any complications?
Yes,
or
and it is usually lifelong, so it's very important to do that.
And it becomes easy for both the patient as well as the doctor to these consultations online, rather than having to wait around, trying to get an appointment with the doctor.
Absolutely.
So, doctor, where do you think liver patients usually get lost in the healthcare system?
I think there are a lot of lacunae here, including, unfortunately, in my own field, because liver transplant is a newer branch of surgery or science, I would say. Many of my own colleagues who are not very well versed with it, they don't realize the urgency of the situation. And sometimes patients who need a transplant, they just kind of get delayed, and they just go on and on with medical management all the time, losing out on their muscle mass, getting sick all the time with regular hospital admissions, losing their resources. So that's why I think it's important to seek a specialist.
Okay. And doctor, do you believe systems like UzuHealth, where we have a teleconsultation process and a streamlining process where patients can book the appointment with the doctor, they have a fixed time and date for their appointments, where laboratory tests can be scheduled in advance. Do you think that cuts down on the cost for both the patient as well as the healthcare system in general?
I think so. Any kind of a structured program will help. I mean, where the data can be looked at in retrospect, where we can have the entire, what the patient has gone through and what kind of consultations has been done. Any kind of structured program will help these patients to recollect, so that nothing is missed, because usually these patients have a complicated and a very long treatment history. So having it in one place in a structured program will help.
But I'm sure it's not all positives. There must be some limitations to these systems, or some situation where a teleconsultation should be avoided, or some cases where you would prefer that patients seek doctor physically or immediately. What would you suggest?
Yeah, sure. I mean, if there is some medical problem where I think they seek urgent care, if the patient, for instance, liver patients can have jaundice, they can have bleeding, they can have a fever which tells us that there is some infection going on, then I wouldn't want them to do a teleconsultation. I would want them to either come and see me or go to a local specialist and seek urgent care.
So basically, the teleconsultation platform, or if the patient does use some platform like this, it should be able to tell them whether their particular case is emergency or non-emergency.
Yes, absolutely.
And if it is emergency, it should refer them to the nearest care facility that can help solve their issue. Okay. How can a system like UzuHealth support these patients better? I'm talking about patients related to your specialty. Than a random phone call or a WhatsApp advice?
So random phone call and WhatsApp, when we answer that, I mean, there is not the attention that we give to a patient when there is a structured appointment and where we are looking at all the reports is very different than when I'm answering a phone call. I mean, I might be operating and answering a phone call. It's always it's better to have a structured appointment and see all the reports and give a proper reply.
I'm sure being a doctor, like, you must get a lot of personal messages or WhatsApp texts regarding, from your patients as well, or do you have a structured system in place for that?
We do have a structured system, but I do get, patients who are just undergone a surgery. I do have personal contact with them in case there is any emergency.
Okay.
So it works both ways, but I prefer the structured program.
Okay. And doctor, what is your message for families dealing with liver or pancreas related reports?
I think the first message would be do not panic. In India, in centers like ours, we have every facility which is available anywhere in the world. And I mean, Indians have progressed a lot in healthcare, in tertiary care healthcare. So there's nothing to panic. Just use, logic and common sense. Do not ignore red flags or alarming symptoms. And I mean, the results are extremely good.
Okay.
Yeah.
So, doctor, we have come to the end of our podcast today with you, and we loved having you on board, and we would love to have you for our future podcast as well. So, before we conclude it, you can just tell our audience, if you want to tell them anything about your specialty or any message that you want to pass on to our audience.
Sure. I think the message that I would say, that liver transplant is a field which people get very anxious about. You have to know that India has, in the last 20 years, India is now the third largest country in the world in terms of liver transplant volume. So we have come a long way in terms of technology, expertise. There's nothing to worry about. The outcomes of these surgeries are excellent, with almost 90 to 95% success rates. So I think it's a good idea to seek help early on, so that the results are much better. And there's no need to panic, basically. Yeah.
Thank you. Thank you so much.
Thank you.
Thank you for your time.